This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 54 in a 58-part video series of the entire book. Please review our introductory video for background information on the entire book. Today we're going to consider a medical subject that is often radioactive, and that's blood transfusions. You may be wondering, why on earth is there a chapter on blood transfusions in a book that advocates enzymes and exercise and rehab? Heart failure is often caused by cardiac conditions that require immediate surgery to save your life. Some hospitals still perform heart surgery with blood transfusions. Many do not any longer. I spent many years designing medical equipment for operating rooms and attending the International Conventions for Surgical Products and the AORN show. I have been exposed to a wide range of surgical knowledge in a practical, non-political sense. We live in a world of special interest groups who seek to profit from medical misfortunes of others, and one of the most powerful is the blood transfusion industry. My grandmother was actually one of the regional directors of the Red Cross, so I learned early on of the corruption inside and the extremely high salaries paid to Red Cross officials to promote blood transfusions. Just follow the money. Blood bank revenue in 2008 was $5 billion, yet in 2014 it was $1.5 billion because of the massive decline in transfusions by using safe surgical practices. The Cleveland Clinic lowered their blood transfusion costs from $35.5 million to $26.4 million in 3 years. They stopped unnecessary transfusions. Many surgeons who graduated from their internship more than 20 years ago have seen amazing transitions to bloodless surgery. There is an interesting, noteworthy aspect of surgical operations. If you look at the doctors and nurses, they're suited up to protect themselves from every drop of the patient's blood. They appear to be wearing hazmat suits for maximum protection. All the medical personnel are trying to protect themselves from diseases transmitted by blood. Even plane crashes will have to put on protective clothing for rescue personnel because handling all the blood is dangerous for them. You have heard it said on television and in movies that blood transfusions save lives. I knew an attorney who asked a medical researcher to read every clinical trial that proved that blood transfusions save lives. He could not find any published. There are thousands of studies on how to conduct blood transfusions, yet none comparing non-blood transfusions with blood transfusion outcomes. All medical procedures are supposed to be covered by clinical trials to verify the performance of each treatment before change. In more than a century, no clinical study, trial, or paper confirms that blood transfusion therapy is more effective than non-blood transfusion therapy. Non-blood therapy is seen in TV shows with emergency medical technicians at the scene of an accident. They start a non-blood transfusion immediately to maintain volumes so the person does not die. These same expanders work in the operating room. Common products include saline solution, Dextran, Hetastarch, Hamacell, Ringer's lactate, glucose, gelofacine, and many others. These replace the volume needed for the heart to continue pumping. At every surgical show I attend, there are many companies and associations showing electrocardiography systems that replace conventional scalpels. An electrocardiography scalpel seals the arteries and blood vessels as it cuts, thereby eliminating most bleeding. Surgery centers now have cell salvage systems that vacuum up any blood that does exit a surgical operation. It then filters your own blood and pumps it right back into the body, so there is no potential for contamination from contaminated blood. When John Paul II was shot in the Vatican Square, he didn't die or almost die from the bullet. He almost died from the infected blood that he was transfused with. HIV, AIDS, and dozens of other diseases are transmitted in the blood supply. The test conducted at blood transfusion companies claim to filter out all of those diseases, but it's impossible because the tests only detect infections that have been in place in the person's system for months and sometimes years. because they're checking for antibodies in reaction to that infection. So early infections are not detected. The number of diseases would be almost impossible to spend the time. It's HIV, AIDS, hepatitis in all varieties, West Nile virus, cytomegalovirus, CMV, parvovirus, herpes, human T lymphotropic viruses, leukemia, Plasmodium malariae, Proteus. I mean, there's just a long list in the book. Although not a disease, transfused blood can contain medications from the donor. And finally, there are transfusion mismatch. The mismatches used to be limited to 4 blood types, plus positive and negative. Now, recent discoveries have expanded the list to 33 genetic types and 300 antigens that can trigger a patient's immune system to destroy the transfused blood without a perfect match. So it's nearly impossible to match. Blood transfusions kill in the way they affect your immune system and trigger inflammation. Blood is not a liquid like water or oil. Every cell in a blood transfusion is a unique genetic coded foreign invader. Your immune system must be compromised to destroy it. Therefore, you cannot be protected against cancer cells and other diseases while your immune system is destroying the transfused blood. Now, reactions to blood transfusions are also often fatal. They can be likened to coagulating the blood in your veins. In the Journal of American Medical Association study of 1966, 2,921 patients who received blood transfusions found that 2/3 were regarded as questionable or unnecessary among the single unit transfusion. A single unit transfusion is the amount of blood a blood donor gives at every visit. In the Wall Street Journal of January 16, 2015, Tim Hannon and Rishi Sikka report that 6.5 to 10.5 million transfusions in the USA are unnecessary, according to the National Blood Collection and Utilization Survey report from the U.S. Department of Health and Human Services. That is 50% of all blood transfusions. Reducing transfusions 30% would save 50,000 lives and reduce 200,000 complications. Reducing blood transfusions 50% would save 75,000 lives and reduce 300,000 wound complications. Now, the latest report from the FDA only indicated 29 deaths from blood transfusions last year. So what's going on? Most deaths from transfusion complications are not reported for medical malpractice concerns. The doctor attending fills out the death certificate. Over 90% of all blood transfusions use refrigerated stored blood. After 24 hours, the oxygen storage and release capacity has been reduced 50%. And after 2 or 3 days, that blood is dead. It cannot release oxygen. It can't do you any good. So the majority of blood transfusions are useless. They're just plasma fillers, which non-blood fillers can do the same work. There are true life-saving blood transfusions. They're performed on severe trauma patients with massive blood loss. They use fresh, warm blood right from the donor. These are very rare. The average male has 12 units of blood volume, and most elective surgery uses 1 or 2 units. That's a fairly minor problem. You can actually survive with a loss of 6, 7, or 8 units if the plasma is replaced. There are many organizations trying to eliminate preventable deaths, and blood transfusions is a major part of that action. It's important to note 120 hospitals in the internet listings are bloodless surgery centers now, and there may be one actually close to you. One thing the hospitals have noted is that their most common patient is a doctor, a medical doctor from another community that is distant. Very few doctors will accept blood transfusions on themselves, but they often don't like the ostracism if they refuse them in their own community. So they travel to these bloodless surgery centers. There are people, of course, like Jehovah's Witnesses that do not accept blood for religious reasons, and they have helped to pioneer this industry. But now the majority of people are informed citizens, informed medical personnel, doctors and nurses who do not want to run the risk of all the diseases it cover are carried by blood transfusions. So that concludes this section. It's information that you may have never heard before. It doesn't fit the usual story that's promoted, yet that's why we had to self-publish this book, because so many amazing discoveries that are common among the medical community are hidden from the general population. I'm J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle edition, from the Apple iTunes Store in the iBooks edition, and from eBay in the print edition. You can also order from the publisher Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24 to cover the book with handling. Thank you for listening.